Hi, everyone. As was mentioned, my name is Arrey, and I am currently a Master of Public Health candidate at Emory University with a concentration in epidemiology. And I received my stem cell transplant at Children's National in 2018 as part of their SUN trial, which is aimed at looking at the efficacy of transplant using a non-myeloablative approach. And Dr. Dvari asked me to join her in this presentation just to share my experience post-transplant. And I can honestly say that I have not had a single episode of sickle cell disease related pain in the 4 years since my transplant. And this is really a stark contrast to my pain experience pre-transplant because I had type SS disease. So as a child, I was perpetually ill and frequently hospitalized. I would say that on average, I had about 2 to 3 hospitalizations a year due to severe acute pain crisis throughout my childhood and adolescence. And it wasn't until I moved to the US from Cameroon and I was exposed to hydroxyurea that my pain experience stabilized. But even with hydroxyurea, I still found myself in the emergency department a few times a year, and I still experience extended hospitalizations due to pain at least once every 2 years. And particularly when I was in college, I found that the stress of the environment really exacerbated my pain experience despite being on hydroxyurea. And I remember in my very first semester when I was at the University of Maryland, I was barely 1 month in when I had one of the worst pain crises that I had ever experienced in my life. And my resident assistant at my dorm actually had to call the ambulance to take me to the hospital. And I subsequently missed about a month of classes. And unfortunately, this would not be the last time that would happen while I was at school. So that's really the primary reason why I like to join these types of meetings and just advocate for transplant. Because for me, transplant has had the single greatest impact on my quality of life as an adult. As Marquise mentioned earlier, the freedom and the liberation that you get after transplant is truly a joyous experience. I can, get up in the morning, go out to the gym, exercise, go for a run, all these things that I couldn't really do before transplant. And I can do all this without like having the fear of having a pain crisis and having to go to the hospital. I can focus on my education and not have to worry about missing classes and all the like. So really, just to highlight the point, I haven't had any pain since my transplant, and it has really been a great experience.
That's great. Eric, can I ask you, in our presentation, I mentioned some of the risk factors, and so I wanted to ask you, prior to transplant, you mentioned you were getting admitted in the hospital, but would you think you had chronic pain, meaning like, did you have pain more than 50% of the days and higher pain ratings?
I don't think that I had chronic pain particularly. I mean, I feel like a lot of my pain was acute. Like when I would have a pain crisis, it would be extremely intense pain. But when I wasn't having crisis, I wasn't constantly in pain. I was relatively free of pain for most of the days. It was only when I had, a flare up that I would experience very heightened pain.
Mm-hmm. And were there like pain medications that were you using, or any other medications prior to transplant?
Besides hydroxyurea, I was prescribed oxycodone, which I took as needed. And so when I was having pain, I would probably take about, I want to say 5 milligrams, like every 4 hours of oxycodone. But when I wasn't having pain, I wasn't like taking oxy. Besides that, I would maybe take Tylenol if I didn't feel like my pain was bad enough to warrant like an oxycodone.
That's great. We are so happy, Arrey, that you're feeling so much better and doing well, and pursuing your dream to become a doctor. So looking forward to all those good things.
Thank you very much.